So you probably just watched me drinking a glass of water there. What does this glass of water and this product that we use in clinic, Profhilo, have in common? So I thought I'd start this talk off by being outside of clinic. The weather is much better and hydration in the summer is key, especially drinking plenty of water. What I would aim for is not worry too much about the volume of water, but make sure that when you are going for a wee, that it is a pale yellow coloured. If it's more like Lucozade, then you're not drinking enough water and you need to stay hydrated. But I did promise you a bit more of an in-depth talk about Profhilo. So what we'll do is we'll reconvene back in clinic and talk a little bit about what Profhilo does for your skin, about hydration, and why it's a particularly great treatment in the summer months. So here we are back in clinic. The lighting is also much better. For those of you who are close, you can see the ring light reflection in there. So that great light on my skin means the sunlight wasn't as strong outside, but I'll shut up about that. So I was talking about Profhilo. So Profhilo is one of the skin boosters that we use in clinic. So this is Profhilo here, made by IBSA. A key point actually that one of my patients pointed out as I was doing Profhilo on her today is that she goes, oh look, you've got that little silver sticker on the box there that means it's authentic. And obviously I wasn't going to take that personally. I was like, we wouldn't ever use fake products, but it is important to actually check if you are a practitioner watching this, that where your products are coming from, and if you are a patient, then it's absolutely fine to not challenge but ask your practitioner where is the product actually coming from. We order ours from a pharmacy. But as I was saying, we're going to talk more about Profhilo. So Profhilo is a skin booster. I was comparing it to that glass of water. It's about hydration. So the predominant active ingredient in Profhilo is hyaluronic acid at quite a high concentration. So most of us are well aware of hyaluronic acid serums and moisturizers, and those work by attracting water closer into levels of the skin where that product may sink into. So for example, if you're using a HA serum and you apply it to your skin, then it acts as a moisturizer by attracting water to it. It's hydrophilic, so it attracts water. And it's that same principle. So when we do use Profhilo, I'll turn it the right way around, and when we do use this on patient's skin, is that we're injecting it quite superficially, and we all look at the areas where there might be crepiness in the skin density isn't as good, and when we inject that hyaluronic acid in, it does a couple of things. One, it stimulates fibroblasts. Fibroblasts are the cells that make collagen. You want more of that, so there's that stimulation effect. And what it also does, it helps to hydrate, because HA will attract more water, so hyaluronic acid will attract more water into the area, and that's how you get that plump, glowing effect. Why do I think this is great in the summer? Because there is that element of dehydration, perhaps not drinking enough water. There's an element of sun damage, which is unavoidable. We want to be out in the sun. We want to enjoy ourselves, obviously wearing SPF. And I think what we've done in clinic is make this treatment more accessible. And so patients can come in more often, maybe between every 3 and 6 months, for a skin boost. And we'll be doing a lot more of it over the summer on the basis that it's, you're attending summer events, you want your skin to be looking at its best. But also when you wake up in the morning, you don't want that crepiness and that after sun effect that we sometimes get with sun damage, where the elasticity seems to go in the skin. You might have seen it after you've maybe been, I wouldn't say necessarily sunburnt or you caught the sun, but you notice those fine lines have crept in, and that's due to UV damage. And this is one of the treatments that we can use effectively to help combat that. So that is our Profhilo talk for this week. The time is to act. What am I talking about? So this week saw the awareness drive for ovarian cancer. This is a little leaflet that we actually got from a project funded by the Gil Harler Fund, which is a UK charity advocating or educating everyone on ovarian cancer. So a smear test, this is on the front of the actual leaflet, smear test doesn't always detect everything. So sometimes it involves actually listening to your body and tuning into it. So ACT is a mnemonic for when to act, when to be worried about things like ovarian cancer, because ovarian cancer is one of those things that we call insidious. It kind of creeps up. It's kind of, the symptoms are a little bit diverse, or how can I describe it? Not clear cut. They can resemble other things. You know, if, for example, you've got a persistent bloating, you might think, oh, well, that's just to what I've been eating, or I'm under stress, or I've always suffered, for example, with IBS. Maybe it's because of that. Abdominal or lower back pain, pelvic pain is obviously something different. I've never experienced it as a man, but obviously those of you women who are watching, you may have experienced pelvic pain or intermittent pelvic pain. Persistent abdominal, pelvic pain, or lower back pain, you might attribute that to a muscular injury, but these are things to be aware of and watch out for. A difficulty eating or feeling full very quickly, abdominal swelling, you know, you feel you're bloated and swollen all the time, even though you're exercising, you're eating well. Abnormal bleeding, so if you're getting intermenstrual bleeding, or you're getting any type of irregular bleeding from the vagina, then that's important to seek advice about. An urgent or more frequent need to pass urine, so we're not talking about the kind of normal symptoms of stress, incontinence, but more so like it's an urge, you're having to go more often, and it's not a urinary tract infection. And then a change in bowel habits, and that can be anything from, for example, you used to go every day, or now you're going 2 or 3 times a day. Your stool has changed in consistency as well. It's not a problem to seek advice. And then the C, so we had this mnemonic act, so we had A, and those were the A's. C, consistent symptoms that don't go away, and a concern that this is not normal for you. And then the T is a time to talk, tell your GP, and obviously this could save your life. So this doesn't constitute medical advice. I mean, this isn't a consultation, but it is about education. So I think ovarian cancer is one of the things that does creep up on a lot of women. It's important to get that diagnosis early so it can be managed and treated. But if you are experiencing any of those symptoms, then don't hesitate to seek advice. This is for education purposes only. I would want you to go and see your own GP or your consultant or your healthcare practitioner. Okay, and I hope that's helped. It's important to raise awareness of these things, especially for women's health. Thank you very much for listening. I hope you've enjoyed this week's newsletter. I'm going to leave you with a little bit of video of 2 visitors that we had to clinic. This is just outside the clinic. Everyone loves a good animal video. So I hope that you are enjoying the change in weather wherever you are in the world, and especially if you're in the UK. And I hope to share another newsletter with you again next week. So I hope you enjoy the little video we've got of 2. No, in fact, it wasn't 2. It was 4 friendly little visitors just outside the clinic.